Did you know there's a silent sign that appears weeks before an elderly person dies, but 95% of families completely miss it? I'm Dr. Vasconcelos, and in my 30 years of medical practice, I've seen hundreds of families lose their loved ones without even realizing the warning signs were screaming for help right in front of them. Today I'm going to reveal exactly what happens inside the human body during those final weeks of life, and more importantly, how you can recognize these signs before it's too late. What I'm about to share with you could literally save the life of someone you love. The human body has an incredible way of communicating when it's preparing for the end, but most people dismiss these signals as normal aging. This is the biggest mistake families make. Your loved one's body starts a complex biological process weeks before death occurs, and understanding this process is the difference between having precious time to say goodbye and being caught completely off guard. The medical term for this is called active dying, but what happens before this phase is what we need to talk about today. Your elderly parent or grandparent might be showing you these signs right now, and you might be brushing them off as just getting older. But let me tell you something that will change how you look at your loved ones forever. The body doesn't just suddenly stop working. It gives us weeks, sometimes even months of warning signs. These signs are so subtle that even trained nurses sometimes miss them. But once you know what to look for, you'll never ignore them again. I've dedicated my entire career to helping families understand these final stages of life, and what I'm about to reveal has helped thousands of people spend quality time with their loved ones instead of living with regret. But here's what most doctors won't tell you about the dying process. There are actually 3 distinct phases that happen before someone passes away, and each phase has its own set of warning signs. Most families only recognize the final phase, which means they miss weeks of precious time. The first phase can start anywhere from 6 to 12 weeks before death, and it's during this time that the most important conversations and connections happen. But families miss it because they think their loved one is just having a bad week or dealing with a minor health issue. The signs I'm about to share with you are not just medical observations. They're a roadmap to understanding what your loved one is experiencing and how you can provide comfort during their most vulnerable time. What you'll learn today will change everything about how you care for the elderly people in your life. But there's something even more important that I need to tell you, something that could save a life today. The first sign that death is approaching happens in the brain, and it's something that looks completely normal to untrained eyes. Your loved one will start sleeping much more than usual. But this isn't ordinary tiredness. This is called pre-active dying sleep. And it happens because the brain is beginning to shut down non-essential functions to preserve energy for vital organs. During this phase, which can last several weeks, you'll notice your elderly family members sleeping 16 to 20 hours a day. They might wake up confused about what day it is, or seem disoriented about their surroundings. Most families think this is just depression or medication side effects, but it's actually the brain's way of preparing for the end. The medical explanation is fascinating and heartbreaking at the same time. The brain starts reducing blood flow to areas responsible for consciousness and awareness, while prioritizing the brainstem, which controls breathing and heart function. This is why your loved one might seem not quite themselves during conversations. They're not being difficult or stubborn. Their brain is literally changing how it processes information. What makes this even more difficult for families is that this phase can come and go. Your loved one might have a few really good days where they seem completely normal, followed by days where they sleep almost constantly. These good days give false hope, making families think their loved one is getting better, when actually these are what we call rallying periods. The body is gathering its remaining strength. During these extended sleep periods, something incredible happens inside the body. The digestive system begins to slow down significantly because the body knows it won't need to process food much longer. This is why you'll notice your loved one eating smaller portions or losing interest in their favorite foods. Their body is essentially telling them they don't need as much nutrition because cellular repair and growth have stopped being priorities. The kidneys also begin to function differently during this phase. They start producing less urine, and what they do produce becomes more concentrated. This is the body's way of conserving fluids and reducing the workload on the heart. You might notice your loved one doesn't need to use the bathroom as frequently, or when they do, the urine might be darker than normal. These aren't signs of dehydration that need to be fixed. They're natural processes that indicate the body is transitioning. But here's what families need to understand about this sleeping phase. Your loved one can still hear you even when they appear to be deeply asleep. Medical research has shown that hearing is often the last sense to diminish, which means those bedside conversations are more important than you realize. Talk to them, read to them, play their favorite music. They're absorbing more than you think. However, there's a second phase that's even more telling, and when you see it, you know time is becoming very limited. If you're watching this and recognizing these signs in someone you love, please hit that like button so more families can learn these crucial warning signs. The second phase brings changes that are impossible to ignore, yet families still don't recognize them as signs of approaching death. This is when your loved one's appetite completely disappears, but it's not because they're being picky or difficult. What's happening inside their body is both beautiful and heartbreaking. The digestive system is essentially shutting down because the body has made a profound decision. It no longer needs to sustain itself for the long term. This isn't starvation in the way most people understand it. This is the body's natural wisdom taking over. When someone stops eating during this phase, forcing food or using feeding tubes actually causes more harm than good. The stomach and intestines are no longer producing the enzymes needed to break down food properly. Any food that does enter the system just sits there, causing discomfort, nausea, and sometimes vomiting. This is the body's way of saying it's ready to begin the final transition. Many families panic at this point and rush their loved one to the hospital, demanding feeding tubes or IV nutrition. But here's what doctors often don't explain clearly. Artificial nutrition during this phase doesn't extend meaningful life. It often causes fluid buildup, difficulty breathing, and increased discomfort. The body has its own perfect timeline, and fighting against it usually creates suffering rather than comfort. During this no appetite phase, you'll also notice significant weight loss. This isn't the gradual weight loss of aging. This is rapid, noticeable weight loss that happens over just a few weeks. The body is breaking down muscle tissue and fat stores because it's no longer receiving external fuel. This process, called cachexia, is the body's way of using its own resources to keep vital organs functioning as long as possible. But there's something even more significant happening during this time that most families completely miss. The immune system begins to shut down, which means your loved one becomes much more susceptible to infections. A simple cold that would normally be no big deal can suddenly become pneumonia. A small cut that would heal quickly might become infected. This isn't because they're not being cared for properly. It's because their body has stopped prioritizing immune function. The white blood cells that normally fight infections are no longer being produced in adequate numbers. The lymph nodes, which filter out harmful substances, begin to shrink. Even the skin becomes thinner and more fragile, tearing easily and healing slowly. This is all part of the natural dying process, but families often see these infections or injuries as separate medical emergencies rather than signs that the body is preparing to let go. What's crucial to understand is that during this phase, comfort becomes more important than cure. Your loved one needs gentle care, pain management, and emotional support rather than aggressive medical interventions. They need to know they're not alone and that they're loved. But the third phase is when things become even more obvious, yet it's still the phase that catches most families completely unprepared. And what I'm about to tell you about the changes in breathing will help you understand exactly how much time you have left with your loved one. The third phase brings breathing changes that are unmistakable signs death is very close, usually within days or weeks. But these breathing patterns are so frightening to witness that families often panic and call 911, not realizing they're watching a natural process that shouldn't be interrupted. The first breathing change you'll notice is something called Cheney-Stokes respiration. This sounds complicated, but it's actually easy to recognize once you know what to look for. Your loved one will breathe normally for a few breaths. Then their breathing will gradually get faster and deeper, then gradually slow down until they stop breathing completely for 10 to 30 seconds. Then the cycle starts over again. This pattern can go on for hours or even days. The medical reason this happens is that the brainstem, which controls automatic breathing, is beginning to malfunction. The chemical sensors that normally tell the brain when to breathe are no longer working properly. Carbon dioxide builds up in the blood, triggering rapid breathing. Then oxygen levels normalize, causing the breathing to slow and sometimes stop. Temporarily. This is not your loved one suffocating or struggling to breathe. This is their body's natural rhythm as it prepares for the final transition. Another breathing pattern you might see is called agonal breathing. This sounds scarier than it actually is. Agonal breathing looks like gasping or deep, labored breaths that happen irregularly. There might be long pauses between breaths, sometimes 30 seconds or more. The breaths might sound wet or rattly because fluids are beginning to accumulate in the lungs and throat. This happens because the muscles that normally clear these secretions are weakening. Families often think their loved one is drowning or choking, but they're not in distress. The consciousness is usually diminished by this point, so they're not experiencing the panic that you might feel watching them. During this breathing phase, you'll also notice changes in skin color. The fingernails and lips might turn blue or purple, which is called cyanosis. This happens because less oxygen is circulating through the bloodstream. The hands and feet might become cold and take on a mottled appearance, with patches of different colors. This is because blood circulation is slowing down, and the heart is no longer able to pump blood efficiently to the extremities. The body is prioritizing blood flow to the brain, heart, and lungs. These skin changes can be alarming to see, but they're not causing pain or discomfort to your loved one. What's important during this phase is positioning and comfort. Elevating the head slightly can help with breathing. Gentle mouth care with a damp cloth can provide comfort. Soft music, familiar voices, and gentle touch are often more helpful than medical interventions. Many families want to suction out the throat secretions, but this actually causes more distress than comfort, and should only be done by medical professionals when absolutely necessary. The most important thing to remember during this breathing phase is that death is very close. This is when you want to gather family members, say important things, and simply be present. Your loved one needs to know they're not alone. But there's something else happening during this time that's even more profound, and it involves changes in consciousness that might seem impossible but are actually well-documented medical phenomena. If this information is helping you understand what to expect, please subscribe to this channel because there's so much more crucial information I need to share with families like yours. During the final weeks, something extraordinary happens with consciousness that even seasoned medical professionals find remarkable. Your loved one might suddenly become very alert and talkative after days or weeks of sleeping constantly. They might ask to see family members they haven't spoken to in years, or they might start talking to people who have already died. This isn't confusion or hallucination in the way most people think. This is called terminal lucidity, and it's one of the most misunderstood aspects of the dying process. Medical science still doesn't fully understand why terminal lucidity happens, but we know it occurs in up to 70% of people who are dying. The brain, which has been conserving energy and shutting down non-essential functions, suddenly surges with activity. Your loved one might sit up in bed, speak clearly, recognize everyone in the room, and seem completely like their old self. This can last anywhere from a few minutes to several days. Families often think this means their loved one is getting better, that maybe they've turned a corner. Unfortunately, terminal lucidity almost always happens within 24 to 48 hours of death. It's the brain's final burst of energy before shutting down completely. During these lucid moments, your loved one might share important memories, express love, ask for forgiveness, or give final instructions. These conversations are precious gifts, even though they can be emotionally overwhelming. The other consciousness change that happens is what appears to be conversations with deceased relatives. Your loved one might look toward an empty corner of the room and start talking to their mother who died 20 years ago, or they might ask you if you can see their deceased spouse standing by the window. Medical professionals used to dismiss this as oxygen deprivation or medication effects, but research is showing there might be more to these experiences than we originally thought. Whether you believe these are actual spiritual encounters or brain phenomena, what matters is how you respond. Don't correct your loved one or tell them the person isn't there. Instead, ask them what the person is saying or how it feels to see them. These conversations often bring tremendous comfort to dying people. They're not frightening or confusing to your loved one, even if they're difficult for you to witness. Along with these consciousness changes, you'll notice what's called the death stare. Your loved one might stare intently at something you can't see, often looking upward or toward a specific area of the room. Their eyes might be wide open but not focusing on anything in their immediate environment. This isn't blindness or confusion. The brain is processing information differently now, and your loved one might be seeing or experiencing things beyond our normal perception. During this phase, communication becomes different, but not impossible. Your loved one might not respond to questions the way they normally would, but they're still processing emotional information. They can feel your presence, hear your voice, and sense your emotional state. This is why staying calm and peaceful around them is so important. Your anxiety and fear can actually increase their distress, while your calm presence can provide comfort. Touch becomes incredibly important during these consciousness changes. Gentle hand-holding, soft stroking of their hair, or light massage can provide enormous comfort. The sense of touch often remains strong even when other senses are diminishing. But there's a physical sign that appears during the same time period that's even more definitive, and when you see it, you know death is very imminent. What I'm about to tell you about the body's final preparations will help you understand exactly what's happening and how to provide the best possible comfort during these precious final moments. The body's final preparations for death involve a process that's both systematic and profound, and there's one physical sign that appears in the last 24 to 72 hours that's unmistakable once you know what to look for. This sign involves the hands and feet, and it's called peripheral cyanosis with mottling. What you'll see is a distinctive pattern of color changes that starts at the fingertips and toes and gradually moves toward the center of the body. The skin takes on a bluish-purple color, especially under the fingernails and toenails, and you'll notice irregular patches of different colored skin that create a mottled or blotchy appearance. This happens because the heart is no longer strong enough to pump blood effectively to the extremities. The body is making a crucial decision about where to send its remaining energy, and it's prioritizing the brain, heart, and lungs over the arms and legs. This isn't a medical emergency that needs to be fixed. This is the body's wise distribution of its final resources. As this mottling progresses up the arms and legs toward the trunk, it indicates that death is becoming very close, usually within hours rather than days. But there's something else happening simultaneously that's equally important to recognize. The body temperature begins to fluctuate dramatically. Your loved one might feel very hot one moment and cold the next. They might throw off their blankets, saying they're burning up, then pull them back on minutes later, shivering. This temperature dysregulation happens because the hypothalamus, the brain's temperature control center, is no longer functioning properly. The body's internal thermostat is broken, and it can no longer maintain the precise temperature needed for optimal function. During this time, you might notice that your loved one's hands and feet feel cold to the touch, even when they say they feel hot. The core body temperature might actually be elevated while the extremities are cold. This contradiction is confusing for families, but it's completely normal during the dying process. The best approach is to follow your loved one's cues about whether they want blankets or want them removed, rather than relying on how their skin feels to you. Along with these temperature changes, the skin itself begins to change texture and appearance. It might become waxy looking or take on a yellowish tint. The skin might feel thin and fragile, almost translucent. These changes happen because circulation is diminishing and the skin cells are no longer receiving adequate oxygen and nutrients. The body is no longer prioritizing skin health because it's not essential for immediate survival. Another crucial sign during this final phase is changes in urine output and color. The kidneys are shutting down, producing very little urine, and what is produced becomes very concentrated and dark. Sometimes urine production stops completely. This isn't kidney failure that needs medical intervention. This is the natural progression of the dying process. The kidneys are conserving the body's remaining fluids and reducing their workload. Families sometimes panic about dehydration at this point, wanting to give IV fluids or encourage drinking. But forcing fluids during this phase actually causes more harm than comfort. Extra fluids can accumulate in the lungs, making breathing more difficult, or cause swelling in the hands and feet. The body knows exactly how much fluid it needs during this transition, and it's usually much less than we think it should be. What's most important during this physical preparation phase is comfort care. Keep your loved one clean and dry. Reposition them gently to prevent bed sores and provide emotional support. But there's one more sign that happens in the final hours that's so significant. It changes everything about how we understand the moment of death itself. In the final hours before death, something happens that's so profound, it changes everything. Families think they know about the moment of passing. This is called the death rattle, but that name makes it sound much more frightening than it actually is. What you're hearing is the sound of secretions in the throat and upper airways that the person can no longer clear because their swallowing reflexes have weakened. It sounds like rattling, gurgling, or wet breathing, and it can be very distressing for families to hear. But here's what you need to understand. This sound is not causing distress to your loved one. By the time the death rattle appears, consciousness is usually greatly diminished and they're not experiencing the sensation of drowning or choking that you might imagine. The medical explanation for this phenomenon is straightforward. The muscles that control swallowing and coughing are weakening, so normal secretions from the mouth and throat can't be cleared away. These secretions vibrate as air passes over them during breathing, creating the rattling sound. This typically begins 12 to 24 hours before death occurs, making it one of the most reliable indicators that the end is very near. Many families want to suction these secretions or turn their loved one on their side to help drain them, but medical research shows that these interventions often cause more distress than comfort. The secretions are not blocking the airway in a way that's preventing breathing. The breathing changes you're seeing are happening because the respiratory system itself is shutting down, not because of the secretions. What's more helpful during this time is gentle mouth care with a damp cloth and maintaining a calm, peaceful environment. During these final hours, you'll also notice what's called agonal gasping. These are deep, infrequent breaths that happen irregularly, sometimes with long pauses between them. The pauses can last 30 seconds or more, and just when you think your loved one has taken their last breath, they'll suddenly gasp again. This pattern can continue for hours, and it's exhausting emotionally for families to witness. Each gasp might seem like struggle or distress, but from a medical standpoint, these are reflexive breaths controlled by the brainstem, not conscious efforts to breathe. The person is not experiencing air hunger or panic, but there's something even more important happening during these final hours that involves the heart. The pulse becomes irregular, sometimes racing, sometimes slowing dramatically. You might feel a strong pulse one moment and barely be able to find it the next. Blood pressure drops significantly, which is why the skin becomes so mottled and cold. The heart is no longer able to maintain consistent circulation, and it's working with whatever energy reserves remain in the body. During this time, many families notice what appears to be a peaceful expression on their loved one's face. Despite all the physical changes happening in the body, there often seems to be a sense of calm or even relief in their facial features. Medical professionals see this so frequently that we've come to understand it as a sign that the person is not suffering, even though the physical processes might look distressing to observers. The most important thing families can do during these final hours is simply be present. Your loved one can still sense your presence even if they can't respond. Talk to them. Tell them you love them. Give them permission to let go if they seem to be holding on. Many people seem to wait for the right moment, or for certain family members to arrive before they pass. Others seem to wait until everyone leaves the room, as if they want to spare their family the moment of death itself. Both patterns are completely normal. What you need to know about this final phase is that death, when it comes, is usually peaceful. Despite all the concerning changes leading up to it, the actual moment of death is typically quiet and gentle. But understanding what comes after this moment is just as important for families. And there's crucial information about the first few hours after death that could prevent unnecessary trauma and help you honor your loved one properly. What happens in the first few hours after death is something most families are completely unprepared for, and this lack of knowledge often leads to panic and poor decisions at the worst possible moment. Understanding these post-death changes is crucial because they're completely normal, even though they can be shocking if you don't know what to expect. The first thing that happens is that the heart stops pumping blood, which means circulation ceases immediately. Within minutes, you'll notice the skin becoming pale, starting from the face and moving downward. This pallor is different from the mottling that happened before death. This is a uniform paleness as blood settles into the lower parts of the body due to gravity. The areas where the body is resting against the bed or chair will become darker as blood pools there, while the upper surfaces become very pale. This process is called livor mortis, and it begins within 30 minutes of death. Another change that begins immediately is the cooling of the body, called algor mortis. The body temperature drops at a predictable rate of about 1.5 degrees Fahrenheit per hour, though this can vary based on room temperature and body size. Within a few hours, your loved one's skin will feel noticeably cool to the touch. This cooling process is why it's important to spend time with your loved one immediately after death if you want to hold their hand or give them a final kiss while their body still feels familiar. The third major change is rigor mortis, the stiffening of muscles that begins 2 to 6 hours after death. This stiffening starts with the smaller muscles of the face and jaw, then progresses to larger muscle groups. Rigor mortis peaks at about 12 hours after death, and then gradually diminishes over the next 24 to 48 hours. Understanding this timeline is important, because if you want to close your loved one's eyes or position their hands in a certain way, it needs to be done within the first few hours after death, before rigor mortis sets in. But there are other changes that can be more disturbing if you're not prepared for them. Sometimes there can be sounds that seem to come from the body, like sighing or moaning. These are just air being released from the lungs and are not signs that your loved one is still alive or in distress. There might also be small movements as muscles relax, which can be startling but are completely normal. Body fluids might be released as sphincter muscles relax, which is why funeral homes and hospice workers place protective padding under the body. What's crucial for families to understand is that you don't have to rush to call funeral services immediately after death occurs. In most places, you have several hours to spend time with your loved one, say final goodbyes, and begin processing what has happened. This time can be incredibly healing for families, allowing for a more gradual transition from life to death, rather than having your loved one immediately taken away. However, there are legal requirements that vary by location. In most areas, you need to notify the appropriate authorities within a reasonable time frame, usually within 24 hours. If your loved one was under hospice care, you should call the hospice nurse first. If they were not under hospice care, you might need to call the coroner or local authorities, especially if the death was unexpected. Understanding these requirements ahead of time can prevent confusion and stress during an already difficult moment. During these first hours after death, many families find comfort in participating in care activities. You might want to help wash your loved one's body, dress them in favorite clothes, or arrange flowers around them. Different cultures and religions have specific traditions around caring for the deceased, and understanding what's physically happening to the body helps families navigate these important rituals with confidence rather than fear. But there's something even more important that I need to tell you about preparing for these final weeks, and what you can do right now to make sure you're ready when these signs appear in someone you love. The decisions you make today could determine whether you're able to provide comfort and dignity during your loved one's final journey. Now that you understand the signs that appear weeks before death, there's crucial action you need to take today to prepare for this journey with your loved one. The most important thing you can do right now is have honest conversations about end-of-life wishes before these signs appear. Most families wait until crisis moments to discuss these topics, but by then, your loved one might not be able to clearly communicate their preferences. Start these conversations during good days when everyone can think clearly and make thoughtful decisions. Ask your elderly family members where they want to spend their final weeks. Do they want to be at home surrounded by family, or would they prefer a care facility with professional medical support? Do they want aggressive medical interventions like feeding tubes and ventilators, or would they prefer comfort-focused care? Do they have specific requests about funeral arrangements, burial or cremation preferences, or how they want to be remembered? These conversations are difficult, but they're gifts of love that prevent families from having to guess about important decisions during emotionally overwhelming times. The second crucial step is understanding your options for end-of-life care before you need them. Hospice care is designed specifically for people experiencing the signs I've described today, but most families don't understand what hospice actually provides. Hospice is not about giving up or hastening death. It's about providing expert comfort care, pain management, and family support during the natural dying process. Hospice teams include doctors, nurses, social workers, chaplains, and volunteers who specialize in helping people die with dignity and peace. They can provide care in your home, in hospice facilities, or even in hospitals and nursing homes. Most importantly, hospice care is covered by Medicare, Medicaid, and most private insurance plans, so cost shouldn't prevent families from accessing these services. You should also prepare practically for the signs I've described. Make sure you have contact information for your loved one's doctors, know where important documents are stored, and understand what medical equipment might be helpful. Simple things like a hospital bed, oxygen concentrator, or even extra pillows for positioning can make a tremendous difference in comfort. Many of these items can be provided through hospice services or rented from medical supply companies. Create a peaceful environment in your loved one's preferred space. This might mean rearranging furniture so the bed has a good view out the window, setting up a comfortable chair for family members to sit nearby, or preparing a playlist of favorite music. Think about lighting, noise levels, and anything else that contributes to a calm, loving atmosphere. But here's what I want you to remember most from everything I've shared today. Death is not a medical failure. It's a natural process that every living being experiences, and when we understand what to expect, we can approach it with wisdom rather than fear. The signs I've described today are not problems to be solved, but stages to be supported. Your role as a family member is not to prevent these changes, but to provide love, comfort, and presence during each phase. The weeks before death can be some of the most meaningful times families ever share together. When you recognize these signs early, you have the opportunity to express feelings that might otherwise go unsaid, to create final memories, and to ensure your loved one feels supported and loved during their most vulnerable time. Every family deserves to have this knowledge before they need it. If you found this information helpful, please share this video with other families who might benefit from understanding these important signs. Subscribe to this channel, because next week, I'm going to reveal the 3 biggest mistakes families make during their loved one's final days that can turn peaceful deaths into traumatic experiences, and more importantly, I'll show you exactly how to avoid these mistakes so you can honor your loved one's final journey with the dignity and love they deserve.